Good morning. So I've got my cup of coffee, got my slouchy sweater, so hopefully this will be a fun PowerPoint. Uh, well, it would be fun on its own anyways because we're going to talk about sexual dysfunction. So when we are looking at sexual dysfunction, we see that there are 4 categories: desire, arousal, orgasm, and pain issues. So the desire type of disorders is I'm just not really interested in sex. I don't enjoy it. I don't, not so much that I don't enjoy it, but I don't have that initial interest to want to get into sex. Once I get into it, there might be some enjoyment, although many times a desire disorder also comes with problems with other disorders. But it may be as simple as I don't want to have sex. Now, everybody doesn't want to have sex at one point or the other, and this is something that we talk about over and over again with sexual issues, as well as pretty much anything else in psychology. What is normal and what isn't? And there is a fine line between normal and abnormal. There's some weird things humans do that's perfectly normal, like handcuffs and kinky sex. That's totally normal. What may not be normal is something as extreme as sadomasochism, which even in its mildest form, nobody would really classify as abnormal. But in its most extreme forms, like for instance, there was a teacher at, I think it was Riverside Community College, who was into erotic asphyxiation. He would hire prostitutes and then he'd strangle them while having sex. I guess if you pay people enough and you're desperate enough, you'll do anything. And at one point, he accidentally crushed her trachea. I think he was using a choke chain, I think, and he pulled or his belt. It was a leather belt. That's what it was, and it choked her. It crushed her trachea, and then she couldn't breathe, of course, because that's where you get your oxygen through. And he probably wouldn't have been in much criminal trouble because it was consensual. Although prostitution's illegal, it was still consensual. But he just took off and left her there to suffocate. So if you ever do that, consider a tracheotomy. Just poke a hole in your prostitute's throat so that she doesn't suffocate to death before you leave her there to die. Or maybe don't get into something that extreme in the first place. Go see a therapist. So anyhow, wow, how did we get that far off track? Talking about what's normal. So it is normal at certain points in your life to not be interested in sex. It's actually perfectly normal during certain monthly times of your life, especially for women, because we have such dramatic hormonal changes throughout the month. So for women, after you have ovulated, you tend to lose interest in sex. It's very normal. So if you track sexual interest, you'll see there's a dip in sexual interest in the days after ovulation. In the days leading up to ovulation, sexual interest rises tremendously because, of course, if you look at the reproductive system, it's called the reproductive system, not the recreational system. So its job is to reproduce, not to recreate. It's not there to have fun, it's there to get you knocked up and pregnant. So of course, when you are most fertile, which is a few days, the days leading up to ovulation, then you will have the most interest in sex, because that's the whole point of that system. It makes it fun just to trick you into doing it. So women will have high desire during that time, low desire during the post-ovulation period, so it's normal. However, desire disorders I have little or no interest in sex all the time. It's not an occasional monthly thing that you can chalk up to certain, to any reason, really. Even if you're stressed out, like let's say you have all these finals coming up, which you do, and term papers coming up, which you do, and you've got, all these stressors, you may lose interest in sex. We would not label you, we wouldn't diagnose you with a desire disorder because of that, because we'd say, no, you're just stressed out. This is more of a stress disorder with a side effect of losing interest in sex, which is not unusual. That's normal, again. So we wouldn't say you had a disorder. Then we have arousal disorders. So in arousal disorders, you want to have sex, you have the desire, but you just can't get aroused. It's not enjoyable. Sometimes these two things come together. No pun intended. They're not coming together. That's the problem. Uh, and so in men, you see erectile disorders where they have a hard time. There's so many puns in this lecture. Sorry. I shouldn't be. I usually do these lectures at night, so I guess I don't know where my brain goes in the morning. I haven't finished my coffee yet. Anyhow, so you have erectile disorder for men, and you have female arousal disorder, which some research has shown is still a type. Erectile disorder is still an issue for women with arousal disorder because the penis and the clitoris are the same organ in the body. If you look at an undifferentiated baby, so a baby that is there's a certain point, I don't remember which day it is into embryo development, where the gender chromosomes turn on and either turn the baby into a boy or turn the baby into a girl. And prior to that, sort of like an undifferentiated sex baby, except for in the DNA, of course. So in that baby, the clitoris and the penis is the same exact body part, and then testosterone makes it grow into a penis, estrogen makes it not grow into a clitoris. So you do get an erection in a sense in both the penis and the clitoris. They're both designed the same way. They both fill up with blood and engorge with blood, and if that's not happening, then you're going to have a hard time enjoying sex. So that's arousal disorder. Orgasm disorder is, okay, I'm interested in sex, I'm enjoying sex, but I either can't get to orgasm or I get to orgasm so fast it messes up all the fun. And then pain, we usually don't see a pain disorder in men. It is typically in women. And there are various different pain disorders we'll talk about. Vaginismus is the most well-known one, if you know any of them. But they just experience pain during sex. And 21% of women experience pain during sex, which is a horrible statistic. But we'll get into that in a few slides. All right, so some other things that we look at in the diagnosis of sexual dysfunction is it lifelong or is it acquired? And that's really important information because it helps you to understand what caused it as well as how to treat it. So lifelong means I've had this issue my entire life. I've never been interested in sex. I've never wanted to have sex. When my husband has tried to get me interested in sex, I've never once in my life have I ever been interested. Acquired is I was perfectly fine with sex until I was raped. And now all of a sudden I have zero desire to have sex. So you can see how those are very dramatically different situations. If it's lifelong, it's probably biological. If it's acquired, it's probably environmental. Although, having said that, there could be new changes in your body that causes an acquired sexual dysfunction. So you can't rule out biological with acquired. So for instance, if you're a man, you could be in a car accident where your penis was damaged and now you can't get an erection because of physical damage. It has nothing to do with your mind. It's just physical. And so that could also be acquired. Then we look at generalized versus situational. Are you always like this? So are you always disinterested in sex when it is with this boyfriend, or has it been all boyfriends? If you tell me that it's just this one boyfriend and you didn't have problems with past boyfriends, then that's situational. And I would say, that would be a huge red flag. Like, what is it about this guy that makes you completely lose interest in sex? I'd be looking for abuse. Has he gotten you into drug use? Various things like that. You can't say what caused it just because it's generalized or situational, but it's just information that helps you to decide how to treat, how to move forward, what things to dig into for more information. And then, is it caused simply by psychological, or is it psychological combined with medical? I don't know if I say it's ever simply biological. So even the guy who got in a car accident and got his genitals smashed and now he can't get an erection, do you think that's not going to affect his mind? Even though it's purely biological cause, there is now a whole environmental, emotional aspect attached to it. Let's get into this in more specifics. So the first desire disorder is male hypoactive sexual desire. Hypo meaning below. So like if you're familiar with thyroid disorders, you could have hyperthyroid, where your thyroid gland is producing too much energy chemicals, or hypo, where it's not producing enough. So hypoactive sexual desire is you have low sexual desire. So little or no interest in any type of sexual activity, including masturbating and sexual fantasies. There's just no interest. It's not just with another person, but no interest, period. And interestingly, this is about half of all complaints at sex therapy clinics. I've always said it's not the women who aren't interested in sex, it's the men who aren't interested in sex, at least with the clients that I get into therapy. I don't know what it is in the entire population. Well, I do know what it is. It's about 5% of all men in the entire population. But in therapy, it's a lot more. A lot of men are having issues with this. And the media makes it seem like men are these sex-crazed beasts who are always interested in sex. And the truth is there's a lot of men who aren't interested at all, which of course can cause a lot of problems in relationships. Now, erectile disorder is the arousal disorder. So this is you're interested in sex, sexual desire is still there, but difficulty achieving or maintaining an erection. And this is the #1 problem for men who come in for treatment. So half of all complaints at sex therapy clinics involve hypoactive sexual desire, but men aren't coming in saying, I'm not interested in sex, can you help me? They are coming in saying, I'm having erectile disorders. So what explains 50% of all complaints? Their wives are coming in complaining that he's not interested in sex with me. Okay? Or it comes up during conversation and then becomes one of the complaints, but they're embarrassed about it, and who can blame them? Erectile disorder isn't as embarrassing because it's so common, it's so talked about. You have like celebrities on TV advertising erectile medications. It's also viewed as something that's easy to treat, like just take a Viagra and you're fine, which is not the case. And Viagra is really bad for you. If a man under the age of 30 has a heart attack, the EMT will automatically look for a Viagra bottle because it's really bad for you. Not that there's not a place for it, but you do have to be aware that there's some major side effects. And then the older you get, the more likely you are to have erectile disorder, mostly because it is a disorder of circulation. So erections are caused by blood entering the penis. As a matter of fact, let me look up a picture for you. Come on, internet. Penis anatomy. Okay. So, hopefully, okay, I'm glad nothing was too graphic. You never know when you look things up on the internet. Okay, so this is the penis, okay? So you see inside, there's a spongy material called the corpora cavernosa. And coming into the penis are 3 of these spongy bodies. And they are sponges that absorb blood instead of water. So you can also see, I know I saw it. Here we go. So this is a cross section. Sorry guys, this is a penis chopped in half, okay, right here. So you have these 3 spongy bodies that when you get aroused, your body sends blood to this area and the sponge absorbs it just like a sponge would absorb water and starts to expand. So if you look at a dry sponge, put water on it, it starts to puff up. Same thing with your penis. So that's exactly what's happening in penis anatomy. Okay, so this does not happen appropriately when you have erectile disorder. So there's not enough blood going to it, and that's a circulation issue. And we know stress decreases circulation, which is one of the reasons why stress can cause heart attacks, anxiety, all of these mental processes can decrease your circulation. So think about if you were really scared or nervous. Like imagine you have to get up to give a speech in class and you hate public speaking. Are your hands going to be hot or cold? They're going to be cold. Why? Because if your brain senses danger, even the danger of just speaking in a college classroom, then it will say your fingers, your ears, your nose, your penis does not need blood flow. Your heart and your liver and your kidneys, those things need blood flow. So it will close off the blood vessels going to your extremities so that you can keep more of it close to your vital organs so that they can pump faster, they can get more oxygen, which is why if you get too cold, you're going to lose your fingers or your nose or your ears with frostbite. So the same thing is happening with the penis. If you are stressed out and anxious, your body will hold the blood closer to the major organs in the abdomen, and you won't get it going to the penis. So that is one of the things that is going on biologically with erectile disorder. So this chart shows you the amount of sexual arousal disorder. So this is erectile dysfunction. How many men have ED per age group? So yellow is none, orange minimal, blue is moderate, and red is they have severe, complete erectile dysfunction, so they can never get an erection. So you see that, right, okay, so this is 40 down to 70. It should be flipped, but whatever. I didn't make this chart. So as they get older, there's less and less with zero erectile dysfunction. So it goes from 65% of men have zero erectile dysfunction to only 35% of men by the age of 70. Complete, so 5% at 40 up to maybe 15% at 70. So obviously the older you get, the more erectile dysfunction there is. And considering it is a circulation disorder, that's not surprising because the older you get, the worse your circulation is, particularly if you don't take care of yourself. And anything that affects circulation will increase the chances of erectile dysfunction, such as smoking, poor diet, inflammation, stress. Any of those factors that at any age affect circulation will certainly affect it as you get older. Also, people tend to be on more medications as they get older, and a lot of these medications, such as beta blockers, will decrease circulation, which again will cause an erectile disorder. So there may be nothing wrong with you. It might be a side effect of a medication that you're taking. All right, so female interest and arousal disorders. So you have the same issues with women: less sexual interest, less sexual activity, fewer sexual thoughts and fantasies, reduced arousal to sexual cues. So even when they see something sexy, they still, they're just not interested. One of the interesting studies, I don't know who thought to do this study, it's crazy. Some researcher wanted to find out if women were aroused by the sound of cars. And so they tested all sorts of different cars, and they tested female arousal, which the way you do it is sort of, I don't know who would volunteer for this study. I'd have to get paid a lot. For men, they put like this rubber band thing around the penis, and it measures the change in circumference of the penis. For women, they actually stick a probe up in you, and it measures temperature and humidity, because the more sexually aroused you are, the warmer you get and the more moist that area becomes. So they measured the changes in sexual arousal based on the sound of cars, and what they found was the more expensive the car, the more aroused women became, which ironically was not the case for men. So men did not show any sexual arousal with cars, but women did. So it's really interesting because it makes sense. If a man really wants to impress a woman, he goes and he buys a nice car. So, I mean, if a man comes driving up in like a Honda Civic versus a Lamborghini, you're going to be much more interested in the guy driving the Lamborghini. And we've always said it's because it's a symbol of money and status and everything, but this researcher said no, it's because women are actually sexually turned on by the sound of a Lamborghini or a Ferrari or whatever. So just an interesting thought there. Now, if you have the sexual interest disorder in sexual arousal disorder. I don't know if that's the case for you, but anyhow, moving right along. Another problem is that they have reduced pleasure or sensations during almost all sexual encounters. Now it says almost all because if this is a psychologically induced thing like anxiety, you've been raped or molested or whatever, had some sort of trauma, then these women can have pleasure and interest if it's in a very low threatening situation. So one of the things a sex therapist might do is give the assignment of go home and give a massage. No sex allowed. You're absolutely not allowed to have sex. Just give her a massage. And because there's this rule that we're not going to have sex, a lot of women can get more interested into it. They're more relaxed. This isn't going to have sex. There's no need to be anxious. And so they can enjoy it. And then they'll progressively move up. Okay, now you can go home and you can do sexual petting. So he can touch your breasts and whatever. And usually it stays in the safe areas before it starts getting down into the groin and anything really sexual. And because there's rules, now the women can relax into that. They can enjoy it more. So they're having more pleasure. They're experiencing more sensations the more relaxed they are. And then the sex therapist will progressively work up to actually having sex. And for a lot of women, by the time they get there, they've learned how to relax and to stay calm during all this other stuff, and now they can enjoy sex. So that's one of the ways you treat this. But again, it depends on what's causing it, because if it's biological, that's not going to help. Then you can have female orgasmic disorder. So there's a delay or absence or decreased intensity of orgasm in almost all sexual encounters. Female orgasmic disorder is not explained by relationship distress or other significant stressor. It can be like I was molested as a child. It can be explained by that, but not like, oh, we're having problems in our relationship and we might divorce. It's not surprising to anybody that you're not going to be enjoying sex enough to have an orgasm or to have a good orgasm. That's normal. We're not going to give you a disorder for that. Or I just lost my job. My husband just lost his job. We've got 9 kids. Really, you're not having fun with sex? Not a surprise. All right. So 25% of women have significant, this doesn't even include the mild, significant difficulty achieving orgasm, which I think is a tragedy. It's also not surprising that 25% of women have been molested or raped. There could be a strong correlation between those two. Also, there's sociological sort of things going on. Women often feel bad or dirty when they're interested in sex. They don't want people to think of them as, a hoochie, a slut or whatever, that they're too interested in sex. So a lot of women feel very shy and restrained, and they're judging themselves, like, do my breasts look okay as I'm laying here? You guys are probably like, I don't get it. Why would they be thinking that? Because we're not thinking it, but yes, they're thinking it. So if you want to have good sex with your wife, hopefully wife, then you need to be reassuring her that I like when you do crazy things or when you're forward about your sexual desire. Let her know that you're okay with this, that you approve of it, and then she'll start doing it more. Because that's what women tend to be worried about is, am I going to be judged for what I'm doing? Because the female world is very judgy. So women are always worried about being judged. And to be honest, men judge women a lot too. So let them know that you are judging them good, positively, and they'll be much more interested in sex. Okay, so for men, their arousal disorder is premature ejaculation. So this is ejaculating within 1 minute of penetration and also before it's desired. So obviously if you wanted to ejaculate that quick, then it's not a problem. But assuming you don't want to, then that's when it becomes a problem. This affects 21% of all adult males and is actually most common in younger, inexperienced males. So for women, women's sexual peak is 35 and men's sexual peak is 19, which sounds like, oh, that's terrible for the guys, but it's actually good because what that means is it takes longer and longer to get to orgasm, to get to ejaculation. So the older you get, that process slows down, which is much more enjoyable for both parties, but especially for the women. So this problem tends to decline with age. It's often a performance anxiety related issue. And it could just be because men's biology is working faster, testosterone levels are higher, and so on. All right, so, but there are different ways to treat premature ejaculation. Let's see. There is a method. If you take my sexuality class, I'll talk more about this stuff, but since this is online class, I get to talk about whatever I want. Okay. Again, worrying about what pictures might be coming up. Oh yeah, this is one actual, that's a real advice that a sex therapist might give, is to masturbate before you have sex, because the more sex you have in one time period, the longer it takes to get to orgasm. So that's something that works. There's also, sorry about all the penises you have to see. The squeeze technique. Okay, I know, weird. But, oh no, this is for condom. But it's the same, I don't think there's any difference between that picture and what I'm looking for. I'm gonna find this. Sorry, and my internet is so slow. My coffee's cold by now. I don't like cold coffee. Okay. Oh, come on, internet. Well, dang it. So anyhow, there's this technique where when he gets close to orgasm, you squeeze the penis at a certain point. Yeah, see, it's the same. I was right, it's the same. Okay, so he can practice it during masturbation, so he can do it on his own. And what it does is it stops ejaculation. And the way you stop ejaculation is with certain muscles inside the pelvis. So if you get more control of that, then you have more control, or you build up the muscle, you have more control of ejaculation. And research has shown that this is actually helpful. Your partner can, your wife, sorry, there's some, see, I told you had to be careful. Although I guess I'm allowed to show you these things. So, all right, so you see, I think that's the same person, holding right up at the tip, squeezing it so that it stops ejaculation, and that helps with the muscles in the pelvic region to strengthen so that you can control that better, and it's pretty effective for helping with premature ejaculation. Women also will practice this for like after you have a baby, because the pelvic muscles get all stretched out. A lot of women have a hard time holding their bladder, and so you can do Kegel exercises where like go to the bathroom, sit on the toilet, this is for women, sit on the toilet and pee, and then stop peeing. Those are your Kegel muscles. And so one of the things you can practice is squeezing those Kegel muscles. It'll strengthen up the muscles of the vaginal wall and tighten that whole area, which is more enjoyable for sex. Will also help you to stop peeing yourself after you have a baby. Better orgasm, things. There's all sorts of benefits to it. So do it, and just practice it before you have your baby too. All right, sorry about all the penises you had to see. Okay, where are we at with this? Okay, premature ejaculation. So then we have the pain disorders. So for females, it's difficulty with vaginal penetration, so the penis going into the vagina. And they'll have pain during intercourse, pain during penetration, pain during ultrasounds, pain during pap smears, just depends on how bad it is. And this is usually caused by fear or anxiety about sex, and then about the pain during sex. So it's sort of this cycle that builds. I had pain, and now I'm freaked out about pain, and now I had more pain, and now I'm even more freaked out, and, you know. So the pelvic floor muscles, those Kegel exercise muscles, tense. And those are strong muscles, and you can tense them so much that nothing can actually penetrate the vagina, even like your doctor's finger during an exam. That's how bad it could be. So one of the things that we would do for you as a sex therapist is teach you relaxation. You might start off with, like, they'll give you, okay, I'm going to risk a Google search again. What would I look for? Genital pain treatment, probably. So there's this series of, oh boy, genital warts is in his, so prepare yourself. I don't know what will come up. Okay. Your genital warts are so bad. Herpes so bad. Yeah, it's not coming up again. So there's this series of, gosh, what do they call this? Yeah, look up vaginismus. Yeah, like this. Okay. So obviously, same treatment with vaginismus. So there's these various size dilators. You start with a small one. You learn to relax with just that. I mean, that's like a pinky finger. Obviously, a woman should be able to handle something much larger. That's what the vagina is designed for. But you can slowly start working on dilating, relaxing. Once you can deal with something small, you go up to the bigger one, and you can train yourself over time to handle, psychologically handle something larger penetrating the vagina. So, yeah, okay. So vaginismus is basically this, genitopelvic pain penetration disorder.